Madam Speaker, this budget reminds me of one of the most difficult patients I've ever had to look after. I remember in the late 2000s working in the old Ward 16 of Wellington Hospital with a mid-age, so 50-ish-year-old man, white South African migrant to New Zealand who had one of the worst gastrointestinal bleeds I had ever seen. Me and 3 nurses worked all night to keep that man alive, but we really struggled, and we were putting blood into him as fast as it was coming out. He actually made it, which we were very pleased about, but the fact is you cannot go on like that for long. That reminds me of this budget because that is exactly what is happening to the health system. This government will crow about record investment to the health system, but the fact is that funding is ripped away the moment it lands in the health system's books. Last year, the government funded the health system to $1.3 billion, mostly by cuts made to the health system's own budget. This year, they have funded the health system an extra $1.3 billion, and that is almost entirely swallowed up by the health system's deficit, which stands at $1.1 billion. While there is money moving around the government's books, the fact is none of it is landing in the services New Zealanders need. And we've heard about how increased superannuation costs for employers, including the health system, is landing in Health New Zealand's baseline, so they'll have to find money for that. The government's botched pay equity promises have to be funded out of Health New Zealand's budget, so that's another call that they weren't anticipating on their budget. That means very little is left for pay rises or filling the vacancies we know exist in our health system. We need more doctors, more nurses, more social workers, more midwives, because every year the health system has to look after more people and older people. That is why every year the health system is said by Treasury to need that $1.3 billion or more, and yet it will not be available to our health system this year. We've heard this afternoon in Parliament about Middlemore Hospital, and I think it is an example that shows the impact of this government's underfunding on the health system. They received a report that said 1,500, a record 1,500 people waited in corridors over a month in Middlemore Emergency Department, 46 instances of serious harm, people dying in undignified settings. And they raised the alarm about this. They asked for $3.6 million, and that could not be found for a large ED in our largest city. That is the state of it. The government is underfunding the health system because it is not putting up the money it needs to keep going and to keep up with growing numbers. And the government will wave its hands and say, oh, well, we've got targets. Well, can I point out that a target without the resourcing to deliver it is nothing but a cynical exercise in shifting blame from the government, who should take responsibility to funding, onto clinicians who struggle to meet those targets without resources. We've seen a series of announcements in this budget about capital expenditure. Well, the net capital expenditure, the total capital expenditure in this budget is $1 billion, far less than in every other year under Labor, except for the last year where it was nothing. So the fact is, this government, when we know we have an infrastructure debt, is underfunding the building of hospitals. That's why Nelson is only getting half the hospital they need. Dunedin's hospital is scaled back. And let me bring you back to Wellington Hospital, where I worked I worked for all of my career before coming to Parliament. What happened there? Well, we moved into a new hospital in 2009 and moved out of the ward in which I cared for that man with his terrible bleeding event. And we moved into a new hospital. Well, the other day, I saw Simeon Brown standing outside that new hospital saying it needed another 36 beds. Only 15 years after we got our new hospital. That is what happens when you underfund capital expenditure, where you scale back every build. These once-in-a-generation projects have to be redone every decade. This government is underfunding health. Do not believe what they say about record investment. It is all going on Health New Zealand's deficit.